This is Get Inspired with Dr. Barb Show. Hello, everyone. Welcome to Get Inspired with Dr. Barb Show. As usually, we have incredible guests on the show who will not be talking only about their background and why it is that they doing things they are doing to improve education, and they are doing certainly amazing things in their fields, in their position, but also they usually share something actionable, real, concrete strategy or activity that can be done with children at home or in school immediately right after you listen to it, and hopefully with understanding. So my job is also to make sure and you can implement immediately. Welcome to the show, Charlotte.
Great to be on, Dr. Barb.
Yes, and so good to have you. And your full name is Sharlet Jensen, and you are doing two things in one job, so to speak. I should say you are a speech pathologist, which is a very important position in schools. And also you are animal assisted intervention, the term, and you also combine these two areas. If you could tell us a little bit more about your background and explain what speech therapist pathologist does for children. And also then how does the animal assisted education or intervention come into play? How does it all work? We're just so curious to learn about it. And this is good for parents, for teachers, and for anybody who cares about education and improving it.
Yeah, absolutely. So, as a speech therapist, I work with kids. I'm personally in private practice at this point, although I have worked in the schools and early intervention previous to my current placement. And so, I work with kids of all ages to improve their communication skills. And so, that could be things like articulation, specific sounds they have difficulties with. It could be language, where they have difficulty putting words into sentences that are grammatically correct. Or a big part of my personal practice is working with kids that have those pragmatic or social communication deficits. So they might have the words to be able to say, but being able to do that in a way to interact with other kids and other adults in a very effective manner is very difficult. So a lot of kids on the autism spectrum, kids with
Yeah.
ADHD, that whole neurodivergent population. And I find I tend to get a lot of really complex kids on my caseload that don't fit into any one particular box. And so it's a lot of troubleshooting, a lot of trying
Wow.
things, seeing what works and what works for the family as well, and collaborating with schools as well to make sure that what we're working on in private speech therapy is carrying over to their everyday lives. And then as an animal assisted interventionist, that's something that I added about, spent almost 6 years ago now. And it was kind of out of desperation. As I said, I have a lot of kids on my caseload that are very complicated. And I live in a kind of a semi-rural, semi-suburban area, and it's a kind of a small group of special education families, and they seem to communicate among each other really well. And so I'd had a few kids that had just really high needs for control and, kind of your traditional, they'd come in with diagnoses like oppositional defiant disorder, things like that. And while I didn't necessarily feel like I was having a lot of success with them in terms of targeting
Mm.
specific things, families seemed to appreciate how I approached working with their children. And so I got a lot of referrals from other families. And so I have had quite a caseload of very challenging kids to work with. And so out of desperation, I decided to start bringing my dog Delta, who I had adopted about a year previously for one particular child that I had just not been able to develop any rapport with. I worked with him several months. And it was just a night and day difference. He knew in advance that the dog was going to be there. We'd built up to that over a period of time. And I, talked with mom that this is an experiment. Like, I don't know for sure how she's going to do. She had a lot of training. I was fairly confident it would go well, but he just chatted. It was literally the first time I'd seen him smile after several months of working with him. And everybody just left that session feeling so much more positive about him coming to speech therapy, about, just
Yeah.
feeling like we could have some bond. And so from that, I was hooked. And, as you know, I went down the rabbit hole of what working with therapy dogs can be, and got pretty obsessed with it, and have really worked hard to learn as much as I can and help share what I've learned with others, because it can be a hard field to break into. There's not a lot of information. There's getting to
Mhm.
be more and more, but especially within the field of speech language pathology, there was really nothing geared towards my profession for how to do this effectively. with kids.
It's amazing what you said because you were obviously qualified to be a speech pathologist. You did your studies. In some cases, people need to do certifications depending on the state and all that. But this is something that I tell my students too, because I teach undergraduate students in the area of education. And I tell them, well, you should really develop a mindset of like this experimentation in teaching, really, because
Mm.
like what we teach you here, I mean, yes, you get some textbooks, you read, you learn, you then go to schools and see how it works, but you will always see a child, if not more than one child in the classroom. You will not be able to, you might be not able to reach in the way you teach. There
Right.
might be, it can be all kinds of issues. And by the way, those issues and diagnosis and the numbers of children, even with just anxiety,
Yes.
these numbers are growing. So teachers, professional development, experimentation, ideas should be also growing. So I think that having this mindset is incredible. And that's what you did. You experimented and you were also very open with the parent. I don't know if it's going to work, but we will try something. And kids often respond so incredibly to an animal as opposed to a person for a variety of reasons. I mean, those reasons are just so wide spread. And you actually mentioned a type of disability diagnosis that I never even heard about. Something defiant, something, something. You see,
Oh,
I can't even say it. Can you repeat that?
oppositional defiant disorder. It's the diagnosis I don't, as a working therapist, I don't find all that helpful, but it seems to be one, at least in my area, that a lot of kids, if they have had any difficulties at school with challenging behaviors, that they seem to get applied to them. Kind of, yeah, I won't go too much.
Very
I have a whole
interesting. It's
soapbox
like
on that.
they're not autistic, they don't have anything else, but if they still don't do what they are told, so to speak,
Yes, exactly.
kind of, which is a
Exactly.
little, yeah, it's very interesting and also a little troubling because I
Yes.
think my idea is, well, if they were taught in a way that connects with them and their interests, they
Yes.
might have not have this problem of being defiant and not wanting to do. And by the way, autistic kids probably they have the same disorder too. It's within their diagnosis. They can be defiant because they learn based on what interests them.
Yes. And also just the different sensory processing and how they
Yeah.
process emotions. I think that information's been around for a while, but I think it's getting more widely disseminated here recently. But I know
Yeah.
early in in graduate school and stuff, we were taught like if a kid's acting out, it's because they're seeking attention or they're trying to escape a situation, and you respond with kind of a behavioral response. And then, fortunately, early in my career, I did some continuing education with Dr. Ross Green.
Hmm.
He's one of many in the field that work with these kids that have, his work is around the explosive child and things like that. And just hearing him talk about how those kind of externalizing behaviors, it's the same panic that those kids are feeling as a child that withdraws and looks really shy or kind of traditionally anxious. And so just continuing to push these kids that are, quote unquote, refusing to cooperate, it doesn't help
Right.
the situation. It just makes it worse. And so coming from that standpoint of how can we get back to calm? That's a phrase I say in my therapy all the time. Let's get back to calm. I do the sign, let's get back to calm. We've got a whole list of things to get there. Several things with the dogs are included on that list, but
Yeah.
you know,
It's amazing that in the educational field, still there's old philosophies that
mhm,
see children who communicate an issue as it's their problem. They
yeah,
seeking attention. And I think if we talk about improvement of education, we have to straighten out this attitude first. If we don't, I see this is actually a huge problem. And then people like us who are incorporating animal assisted education intervention and also trying to get these practices, if done responsibly, of course, and properly,
yeah.
get them out to school districts more. That is also a challenge, right? What do you think?
I agree. And definitely having the dogs there, it really helps because it's kind of that neutral third party. The child and I can be talking to the dog or doing something for the dog, or I can ask the child to do something for the dog's sake instead of having it be, I'm telling you to do this, you need to do this now.
Yeah,
And so it just takes away so much of that power struggle just naturally. Like I don't
yeah,
feel like I'm doing anything, extra above and beyond what I would normally be doing, it just immediately takes away that power struggle. And I certainly get a lot of comments from parents of these kids that they're like, wow, my child does so much, work while they're with you compared to, school or home or, after school activities that they do. And the dogs just really
Yes.
facilitate that. But you commented that increased anxiety too. And I don't know the exact numbers and things on that, but I had a student last week that was doing some job shadowing, and I was just commenting to him that early in my career, I felt like it was the occasional kid that had anxiety that came in,
Mhm.
and that, that I had to work around. And now it's like the rare child that comes in and is in a place where they're ready to just jump in and work. It's really been striking to me over the last, 5 to 10 years how prevalent this is, and how we need to have more education on it, because we can't address the speech and language goals until we get the self-regulation or
Totally.
co-regulation at least.
And I think we have to do so. Being that I'm a professor in the area of education, I'm trying to spread this awareness among my students. But we need more of this. This should be a part of teacher preparation, don't you think? And
Absolutely.
I don't think there is, I don't know how many colleges or, teacher preparation departments are paying attention to it. Probably 0 point blah, blah, blah. I don't know. Very few. So it's like, how do we make this more? It's difficult because the field is also very kind of traditional, and the way the field works and how conferences work is also a structure. And you know how it is with the systems. It's hard to kind of change them. But yeah, we do what we can, and certainly I share this information. But I think what it is really is just something so simple. If you do not create a climate for the student in which he mentally feels safe to be themselves and to learn, how do you expect them to learn? And the
Yeah.
student comes to the classroom, there are other kids with their own issues, challenges, whatever. And then there is the teacher who is an adult, but sometimes maybe it's just a stranger to the child. And then you've got the desks, and then you might have a carpet maybe, but when you think about it, the environment in the classroom is not that cozy and welcoming that much.
Right. It can be a lot, especially like say the kids that I work with, can have a difficult time interpreting, the interactions from other kids too. And so if kids are bumping into them and,
Yeah.
these crowded classrooms that have so many kids in them, it's been nice in my area. I'm in Arlington, Washington. I've definitely seen since COVID an increase in some kind of untraditional school options where there's hybrid of they're in class part-time and part-time homeschooling, or, real
Wow.
small group specialty programs that are unfortunately, they're all through lottery. There isn't nearly enough space for all the kids that would benefit from that.
Yeah.
But I've definitely seen some of my kids who just struggle to, achieve what they should be able to achieve in a traditional classroom environment, be able to really thrive in those real small, kind of personalized environments.
That
And
is so interesting. I have to learn more from you about it, because maybe it
absolutely.
would be a great idea to interview like a principal, someone from these places. That's the reason I'm doing my podcast, just spread these ideas. And I wanted to also say that maybe not many people realize the importance of this position, the importance of your work, speech pathologist. I know that the word pathologist is kind of, uh, it's a little kind of, I don't know, doesn't sound
Not
pleasant,
user
right?
friendly. Yeah, it's not a very user friendly. I say speech therapist or
Yes,
animal assisted speech therapist. I know
yes.
our ASHA, our professional organization, prefers that we use the term speech language pathologist to
Yeah,
convey
because
the
it's
science
an
behind
official
what we
it's
do.
an official term. But I think that maybe some people think, well, just speech pathologist just kind of like corrects the
Right.
pronunciation and all that. And I used to think that too, I'll be honest with you. And then my child did have speech therapist.
Mhm.
And that it actually opened my eyes, because I'm like, oh, wait a minute, they're not working on her pronunciation, they're working on some other social skills and other things. And I was like, really? That's what they do, those speech pathologists? It just opened my eyes. So, what you do, and especially helping autistic children, they need this so much, that help. And then incorporating animals. This is absolutely amazing. And I already hear from you. You have anecdotal but very important data coming from these parents who tell you their reaction, and really what you're doing is helping the children but also helping the families, helping the parents.
Yeah, it's fun. I've kind of recorded some things that the kids will say as well, and I do have a book out called Pause for Progress, and in it I was able to interview a couple of the kids that I work with, and one of them mentioned that when the dogs are there, she's a child that comes in for some literacy interventions because I have a special interest in reading as well, and she mentioned that she loved having the dogs there because when she was feeling frustrated, the dogs would come over, and she would just feel so much more calm and able to keep going. And this was a child that I didn't realize had any anxiety over coming to reading therapy and doing the work, because she was always just super happy to be there, super cooperative, trying her best. And if I hadn't asked that question of, why do you like having the dogs there, I would have never even known she was feeling anxiety. As opposed to some of my other kids who do have that more, resistant behavior profile. But yeah, it was really interesting.
This is very important because for some kids, you don't see anxiety.
Mhm.
And like you said, you didn't know until you found out directly. It's probably safe to say that almost everybody, almost every kid in school probably has some level of anxiety. I mean, honestly, I
Mhm.
think it's just a part of life. We all do to a certain extent. I would like you to mention, if we have some time, maybe one more powerful sort of story situation when what you did and with inclusion of your dog really helped the child. But maybe before we do this, if you could share that strategy, this activity,
Oh,
we
yeah.
just we want to make sure that we have enough time. Something that's simple enough for people to just kind of, all right, I'm just going to do it. It sounds really cool.
Yeah. So I have kind of a couple variations on this, but
Yes.
the first one, if you do have a therapy animal, one of the most common ways that I incorporate my therapy dogs is just those transitions. So in and out of the therapy room, between places. So when kids come to see me, we always start by washing our hands just to, help minimize
Yeah.
the spread of germs and things. And I have a lot of kids that are resistant to that for various reasons, whether it's sensory or they aren't quite ready to get into the work mode yet. And so I'll have my dogs. They're trained to come stand on the footstool next to the sink with the kids. And my one dog, I can even lure to put her paws up on the counter and kind of watch while the kids are washing, and just kind of have the kids direct the dogs of like, oh, here's what we need to get. Depending on their amount of spoken language or communication abilities, I can personalize that.
Wow.
And then the biggest thing is occasionally I have kids early on who have difficulty transitioning in. They don't want to, come into the building. Usually once they find out, I've got a ball pit and swings and the dogs and a fish tank and, so usually once they've
Yeah.
come in a couple times, they're happy to come in, but they sometimes don't want to leave. And so we can have quite a challenge keeping them calm and regulated to leave the office and go out to the parking lot. So I'll just I'll have them grab the dog's leash or I'll grab the leash and say, can you help me? Delta really needs to go out and go potty. Can you help me walk her? And it makes it meaningful. It gives it a purpose. Again, we're not just telling them to do this because it's time to
Hmm.
go. There's a reason behind it. And then again, just incorporating that, that warm, caring body of the dog. However, I have had some times where, like, if I've had an appointment before or after work and I'm not able to bring the dog with me because I don't want to just leave them sitting in the car, that there are days that I don't have the dogs with me, and so I got stuffed animals that look very much like my two current therapy dog partners, Sky and Delta.
Wow,
And so
great idea.
I found the kids love them. They call them Little Sky and Little Delta for the most part, and having them carry those stuffed animals from place to place. Or, someday they're just having a harder day. They'll want to just have that
Yeah.
stuffed animal there with them. Sometimes they've got their live dog on, right up by their side and then the stuffed animal clutched in their arms. And so even if you don't have a dog that maybe comes to, your classroom or
Hmm.
your office space, if you have a dog at home that the kids are familiar with and have seen videos and pictures and heard stories about, having that stuffed animal that looks as close as possible to them can be something special that they can carry with them if they're having a hard time leaving one activity and moving on to a new one.
I love this idea of transition, and I'm just trying to understand it too and imagine, like, let's say if we utilize my own therapy dog, Carmel, let's say we have a classroom of kids, we go to the class, full class of children, so you're going to have 20, and let's say some kids are just like reluctant washing their hands after the project and before they transition to the next class, to the next subject, something like that. I could say something like that. I could, instead of telling them, oh, come on, Johnny, you got to do it, right? So again, we're telling them what to do. Instead of doing this, I could say, Carmel, are you ready to clean up your paws? And she would be naturally following me, I hope, right? I can always
Yeah.
use a treat or something, right? Come on. And then I could say, Look at that. Look how eager Carmel is to clean up her paws. And I can even even if she doesn't do it by putting her paws into the sink, I think the sink is kind of higher in that classroom. So it'll be difficult to do it, or train her with some kind of stool or something that can be
Mhm.
dangerous, I guess, too. So I'm not going into that. But I could just by calling her, come on, you ready to clean up your paws? And I could tell them, well, listen, kids, obviously she's not going to do it in the sink because she's the dog and she cannot reach that high. But I've got those little wipes here, and I can have like regular wipes,
Yeah,
not soaked
and
with
that
any kind of chemicals or anything. Clean her paws and say, "Come on, everybody, Carmel's doing it. Aren't you ready too?" Right? What do you think about this variation?
absolutely, yeah, and working with the 2 dogs, my 2 dogs have very different temperaments and different things that they enjoy doing and don't enjoy doing, so Delta, she's just always been happy, like, it wasn't something I had to train her, she just would come stand on the footstool next to the kids,
Mm-hmm.
and Sky, who's a much smaller dog, so it's probably a little physically more difficult, and she's also a little more anxious about getting bumped into by the kids. With her, it was definitely a training process to get her to do that.
Yeah.
And I still have to read their body language and
Yeah.
their comfort level with it because some days they're more willing than others. But I also had a child who has, very significant support needs. And his mom had just mentioned, it's not really what a speech therapist would traditionally work on, but his mom had just mentioned that he'd been really resistant to hanging up his coat. He had a lot of fine motor
Uh-huh.
difficulties. It was very difficult for him to find that, little hook in the little loop in the coat and hang
Yeah.
it up. And so I just threw it in at the beginning of our sessions for a few weeks, hanging up the dog's little coat blanket, even though the time of year it was, she didn't really need her coat on, but I just made sure that the dogs had their coats on when he came in. And so he got to practice with them. We took his coat out of the equation for a few weeks just to get
Yeah.
the practice of that sequence, that motor sequence of what he needed to do. And he thought that was just hilarious. And then
Yeah.
mom was able to bring it back into home life of hanging up his coat. And she said that, it was like he'd forgotten that that was something he hated doing. He just suddenly was willing to try it again. And all those ways of just,
Yeah.
having it be something that you're doing for the dog just takes that pressure off, I think.
Totally. And kids want to do something for the dog. They want their dog. We notice that too. They don't want to do anything that would like maybe scare the dog of coming back to
Mhm,
the classroom, right? They want to make sure that the dog feels good, but it
mhm,
gives them this responsibility because all of a sudden, like they don't just worry about themselves, what's going on around, but they
mhm.
actually start thinking in this care mode towards that animal. I mean, this opportunity of really improving education by including therapy animals is just so incredible. And I really wish more people knew about it. But that's why we're doing what we're doing, right? We're not just taking our dogs, but also trying to spread this awareness on social media or by doing the podcast. So we'll just have to keep doing what we're doing.
I like to just make sure people know that it's an option because, again,
Yeah.
especially as a speech therapist, it's just not something that was really seen. Social media has its good and bad sides, but one good side is
Yeah.
that we are able to share with a wider audience some of the less traditional approaches that are available.
Hmm.
And then, yeah, and so I know I certainly had bosses in the past that I would bring it up. I didn't have enough knowledge to really be able to advocate for, how I would
Yes.
keep the situation safe, mitigate risks as much as possible and how and why it would be effective. It was just ideas that I brought up to, previous employers and they were always immediately like, no, we're not going to take that risk. But there are ways to, there's no guarantee. There's always some risk involved when you bring an animal in, but there are
Hmm.
definitely a lot of ways if you are educated to minimize those risks and keep it as safe as possible. And I wanted to mention too, again, population that, inspired me to start working with animals. There were some kids that I was really hesitant to bring my dog in because they had some aggression against humans, kids that would, slap or scratch, if they got,
Hmm.
really upset. And so I was really had some kids that it took me a long time to feel comfortable trying bringing the dog. And with one exception, I had one kid that it just wasn't a possibility. I actually ended up referring him to another provider because he did, kind of intentionally go after my dog one time,
Oh,
and I
yeah.
could tell that it just wasn't going to be safe for everybody involved. But some of
Yes.
my
Very
hardest kids,
important.
yeah, some of my hardest kids, they're so sweet with the dogs and they're so gentle and they, really respond much.
Oops, there's my dog.
There's your dog. Hopefully mine don't hear it and start barking too. Um, but yeah, so I've gotten more and more willing to, to just, and my dogs are off leash too. When I have one at a
Yeah.
time that's there, but when my dog's there, they're off leash, so they have that ability to, leave the situation if they're feeling uncomfortable, or go to their bed, or go to my office to get away from the situation. But I've just been
Yes.
surprised at how well some of my kids that you might initially think like, oh, this isn't going to be safe, how well they are able to do with the therapy dogs.
That's amazing. It's just a matter of being carefully monitoring that,
Mhm.
especially this beginning of interaction and throughout all times. But yes, there are some children who cannot interact with your therapy dog for
Mhm.
obvious reasons, and that's why we have to be mindful. And it's just the dog. You always have to observe your dog, right? In this
Yeah,
interaction, what's happening. You cannot stop observing, because if you stop, you don't know what's happening, either what the dog is doing or what the child is doing. Some of
yeah,
them, they might not, even if they know or they were taught how to interact with dog, they might be doing something in a sneaky way that is
yeah,
not good for the dog. They will do that, right? Some
yeah.
of them. So it's
Yeah,
like even more.
I've got
This
one right. I've got one right now that just loves to explore their hair and see
oh,
like the skin is
jeez.
right underneath the hair. So I just have to. He's not doing it with any intent to,
Okay,
be
to
mean
harm,
or anything.
right?
But so I just have to constantly, remind him
Yeah,
of how we pet Delta, because he just wants to explore. And then that little skin where her hind leg attaches to her stomach, the flank,
yeah,
it's kind of stretchy and thin. And so he'll, if I'm not watching closely, he'll start just kind of pulling on that. So a lot of that teaching that dog etiquette, having those boundaries in
yeah.
front of
So
the
they
kids.
kind of like exploring, and they don't mean any harm,
Right.
but their exploration is not always a good one. So they just
Yes.
need to be instructed. Yeah, I've noticed that too. Um, Charlotte, if you could share with us maybe one powerful situation when what you're doing really helped the child, and then I would like you to mention anything you would like to mention about your activities, and also where we can follow you on social media.
Sure, absolutely. So another one that just comes to mind off the top of my head is a young child I was working with. He's only 3, and he actually hadn't shown that much interest in the dogs.
Hmm.
He has autism and just hadn't been super aware that the dogs were in his environment. And because he didn't show a lot of interaction with them, they, would usually just go kind of lay on their bed while he was there. But one day I pulled out this long, I have like a 10-foot long tunnel, and I, brought it out for him. So he went through it, and my dogs both love the tunnel too. So my
Yeah.
dog just kind of spontaneously got up and ran through the tunnel, because she knows usually she's going to get a treat when she does that. And that caught his attention. The novelty of that just grabbed his attention, and he got so excited. He was running around. He's a child that, a lot of times we think about, getting, back to calm, like, slowing our body down. But for him, he was one that really needed a lot of work to kind of get energized and get, awake, so that he could participate in sessions, or else he would be just really hyper focused on some little thing. So that just grabbed his attention, got him really awake and paying attention. And he and Sky were taking turns through the tunnel, and the amount of language, like I was fortunate enough, about 5 minutes in, I asked Adam, like, can I grab my camera and just start recording this? And it's not a great shot, like I didn't have the angles or anything, because I wasn't going to disrupt what was happening. But the just amount of spontaneous language, and seeing him change over like a 10-minute period from just imitating, just echoing what I was saying, like, your turn, Sky, where he was breaking it down into, novel word combinations, which was one of the first times we'd heard him do that. It was great. And then for several sessions, that was all he wanted to do. And then he kind of got over it. We've moved on to other
Yeah.
things since then, but it's really amazing the amount of spontaneous language that the dog's actions can motivate in kids. And as a speech therapist, that's always my biggest goal, my big overlying goal with these guys.
Amazing, amazing, Charlotte. I know we could talk more and longer about these situations and results and children's just their reactions, right? It's because you can often see on the faces when they interact with the dog. Isn't it amazing to like see their faces and what effect it has on them? You can already see in their like their faces. They say it really all.
Yeah.
Where can we? I know that if you would like to mention your book or anything else, your other activities that you engage with on social media, and also where we can follow you, where people can support you, connect with you.
Absolutely. So I have a website, www.speechdogs.com, and I have a lot of resources on there. I'm adding to it all the time. I have a blog that Dr. Barb and some others actually just recently contributed to. It was a great article. I've
Thank
gotten a
you.
lot of really great feedback on everybody's contributions on working with dogs and teaching social emotional skills. But I also have on there a free roadmap to getting started with a therapy dog. If that's something
Mhm.
that you're interested in pursuing and you're not even sure, how to get started in that. I do have the book Pause for Progress, Integrating Animal Assisted Interventions into Your Speech Language Pathology Practice. I'd say
Wow.
about 80% of that book really would apply across fields, but there are a lot of activities that are more speech therapy focused, especially towards the end of the book. And then I do also have an online course available as well called Talk to the Paw, including our therapy animal inclusion in professional settings. So that's a real in-depth deep dive if you're interested in that as well. And then I'm on Instagram and Facebook at Speech Dogs. It's speech_dogs, but always feel free to contact me. I've got a contact form on the website, and I love talking with people. I've gotten a lot of interest from students, what we call
Mhm.
SLP2Bs.
Mhm.
Students and new grads seem to be really embracing some of these non-traditional speech therapy approaches and are really open to learning more. And I just love being able to share what I've learned because I learned most of it through trial and error. And then as
Yes.
AAAIP and some other organizations have become more widely available over just the last few years.
Yes, they are not been they've been only I think 3 years. So this is
Yeah.
they are very new too. I would love to share like about your books, about your book and resources like on my platforms too. Just, let me know if there's something like that so I can kind of like make a post and hey, speech
Absolutely.
pathologists or teachers, let teachers and also speech therapists know about these resources because this is really incredible. Are you
Yeah.
on LinkedIn too by any chance?
I'm not on LinkedIn, not yet
You
at
need
least.
to be there. I know. It's like asking you, Charlotte, you have to be everywhere. I was not, but it's an amazing platform. And notice the people who have dogs and do activities related to dogs are not as active there. So
Okay.
you can have a lot of attention. So worth considering.
Okay. Good to
And
know.
that's where I could share your resources too. And there is great response and interest from people from all kinds of areas of expertise, not even teachers who are interested in what we're doing.
And
So
I know
I am just, yeah.
I know more schools are getting dogs too, and often they're like with the counselor or
Hmm.
one of those professions. But I feel like there's so much, and obviously dogs need a lot of downtime and breaks. So I'm not saying that, the dogs should be available to the
Yes.
speech therapist in the school 24/7, but I
Yeah,
think there are definitely times where those collaborations could be really powerful for certain kids if the speech therapist
exactly.
knew that that was an
Exactly.
option.
I'm not so sure about things such as like school therapy dog belonging to school. I think it's a little I have a problem with that a little bit, but this is like for another topic. I think
Mhm.
that the dog needs someone who is that person, the owner, so to speak, who's taking care of the dog. I think like this is something I'm not sure, but maybe there are some cool practices where this is happening and someone is really looking after the dog. I just don't know much about it. I
Yeah, the
didn't
ones
hear good
I've
stories
seen.
about it. That's the
Yeah.
problem I think that I have.
Yeah, the ones I've seen have been, with the counselor. They have
Yeah,
a
well,
designated handler and they go
that's
home with the
that's
counselor.
really good. And there's that's another profession, school counselor. They should have a therapy dog. Poor kid comes in with the problems. How are you going to speak about your issues openly if there is not cute animals you can kind of relate to? Charlotte, this is so great and so much information. And again, I'll be so happy to share more about your resources and about your book on my platforms. And I really appreciate this wonderful conversation. And we want to thank everybody for listening to the show. Please follow Charlotte, share about her resources. The more teachers and parents know about these resources, I think we have a better chance of like doing something in education, improving it. Follow the show, get inspired with Dr. Barb to always stay up to date when the new episode comes out. And we'll see you next time. Thank you so much. It was absolutely lovely.
Thank you.